Hi, everyone. I am Dr. Kim Shepard with Align Family Wellness, and welcome to your webinar on crafting the blueprint for your healthiest pregnancy. I'm so excited to do this webinar with you. So let me get back to my first slide. Okay, so today we're going to talk about the physical, emotional, and hormonal shifts that happen during each trimester. We're going to talk about building your birth team, who you want on your team and why. We're going to talk about chiropractic in your pregnancy, of course, because I'm a pediatric prenatal chiropractor. If you are in your third trimester, we want you to go back and watch our dystocia webinar, which you can also find on our Instagram page, or we can send you a link for that. It talks about how chiropractic plays a crucial role in birth, and it's just really, really good for you to listen and actually learn a little bit more about chiropractic and how that affects birth and babies. So watch that if you're closer to your delivery day. But just a little bit about me. I wasn't always a pediatric and prenatal chiropractor. Treating mamas was not always my passion. I was a very pain-based chiropractor. I did a lot of sports rehab and just chronic back pain. And I realized that made me pretty unhappy pretty quickly, treating people that were always in pain and were always just kind of grouchy when they came in. And I realized right around COVID that something in my practice needed to change. And I didn't want to treat traditional just pain patients anymore. And I really learned more about treating moms and moms during pregnancy and realized how important this is for mamas and how our town was not providing this service for these moms and how much I wish I had this information when I was pregnant. And these moms just lit me up. I love to treat a pregnant mama, but I also love to treat that newborn little baby that has been, in that mama's belly that I felt move, during those 9 months and then come here earthside. And then I'm able to care for that baby in their first few weeks of life and watch them grow up. So it's truly been rewarding, and it truly has changed the trajectory of my life and my practice. And I'm just so grateful that I have a chance to do this and take care of you wonderful mamas, because it's just life-changing for you and for me. Okay, moving on. So we're going to talk about first trimester. A lot of this information is stuff you guys already know, but just bear with me. Your first trimester is 3 months from weeks 0 to 12. So it's a period of rapid development for the baby. Significant physiological changes happen for mama. You go from, finding out you're first pregnant to getting a little bump, maybe getting your first ultrasound. We have a lot of cardiovascular and respiratory adaptations that happen, in baby, also in mama, and there are neurological changes. Some of the first stuff to form in baby is their brain and spinal cord. And, it's just amazing how this process happens as we're developing this child inside of us that we literally just don't have anything to do with. We just, let God do his work, and it's truly, truly a blessing and a miracle. So some of the changes that can happen during that first trimester, obviously, if you're pregnant right now, you are having some hormonal fluctuations. So the surge in pregnancy-related hormones, specifically HCG, progesterone, and estrogen, affects our neurotransmitter levels, which affect our mood and our emotions. You're going to cry at the drop of a hat. You're going to be angry at a drop of a hat. You're going to feel sad and glad and, upset and mad at your partner. It's all because of those lovely hormones. So our cardiovascular system, our blood volume and our heart size increases 15 to 20% in that first trimester. We need more blood flow, and we need nutrient delivery to both mom and baby. So, we have to have more blood, and our heart has to work a little bit harder to be able to support all of this growth. So our respiration has to increase by 40 to 50%. That's driven by the hormone progesterone, which helps to improve the oxygen exchange. But, a lot of people will get shortness of breath, especially when baby is like literally sitting up here, up underneath your ribs. But your lungs are actually fine. It's just, you just don't have a lot of room. Babies sometimes are sitting up underneath those ribs. So there's just a feeling of shortness of breath because you get a lot of restriction in through that rib cage. But your lungs are fine. Everything is within normal ranges, but you just can kind of feel that shortness of breath with baby just pushing up. Everybody feels fatigue, that increased progesterone. Even when we're not pregnant, that second half of our cycle, when our estrogen changes to our progesterone phase, man, you feel that. You feel that exhaustion, that tiredness. So, we're trying to support baby's fetal development. You are growing a human. Like, it's going to take a lot of energy to grow that human. I've seen stats anywhere from, 1 day of pregnancy is like running a marathon on your body. That's how much strain it puts on you. It just, no wonder you're so stinking exhausted. Sensory changes, you can have changes in taste and smell, and you get things that you crave, things that you don't want. And it's, it's a way for your body to avoid harmful substances. But, in my case, I couldn't stand texture, like cottage cheese and yogurt, things like that. So, that really, it's not like a harmful substance. Smells really affected me. So, people with like stinky feet were really, really hard for me to be around. Just everything's heightened. I think our senses are just really, really heightened at this time. So, okay. So just some practical advice. Get exercise. Try to move your body, but also rest when you need it. Listen to your body. And, we want you to be active, because the less active you are at the beginning of your pregnancy, sometimes the harder it is, when you put on that 20 or 30 or 40 pounds to carry that weight later on. BirthFit is an amazing support system for workouts through pregnancy and postpartum. And their founder, Lindsay Canto, is actually a chiropractor. So we love BirthFit because it's very much aligned with chiropractic. Just rest when you need it. Sometimes we feel like we've got to push through, but I always say, I've never felt fatigue in my life like I felt in my first trimesters of pregnancy. I could be sitting up in my chair in my office for like 2 minutes and close my eyes and want to fall asleep. It is real, that fatigue. It is very, very difficult. Just give into it, get the sleep when you need it. When baby comes, you're not going to sleep as much. So just try to rest your body. You're growing a human. It takes a lot of effort. Try to get whole foods, get your vitamins and your minerals. I know a lot of times you're throwing up or you're nauseous and you don't feel like eating. But this is the time we need to nourish our body, because that umbilical cord is a power cord to that baby. Everything you put on or in your mouth or your body goes straight to that baby. And we really, really, really need to take care of it and nourish it and give it whole foods. Watch your supplements, watch the products. And we'll talk a little bit about, the biggest one is, folate versus folic acid. And we'll talk about that later, but just make sure you have a good quality vitamin. You're not buying your stuff at, Walgreens or Walmart. We want something good that's absorbable and, can give you the nutrients that we're lacking. B vitamins are huge, and protein-rich foods do help alleviate morning sickness, even though sometimes we don't feel like eating them. They are really good for us. Almonds are great for, being hungry at night and to keep your blood sugar stable. Those are also great whole foods. We can do like some milk thistle, which helps our liver and it helps with morning sickness. We want to stay hydrated, and we want to make sure we're getting minerals with our water, so that we're actually absorbing the water. We give all of our pregnant mamas some LMNT packets that have good minerals, potassium, sodium in it, that I use those every day just to help with my hydration levels, but super, super important for mamas too. The toxic load we talk about more in our preconception dystocia webinar. So go back and watch that, because that's got a ton of information about toxins to avoid. So why should you start chiropractic care in your first trimester? We get that all the time. When I find out I'm pregnant, when should I come in? Well, hopefully we're treating you before you're pregnant, and we just move into, treating you during your pregnancy. But some of the reasons you should come in is that it helps alleviate nausea. It helps the nervous system function. It aids in digestion. We do a lot of acupuncture for nausea in our office. The pain, everything's changing and shifting. So we can help manage pain in the neck or back or the joints by making sure that the spine's in alignment and the nervous system's functioning properly. Proper alignment also helps to manage those early pregnancy discomforts. A lot of people will get a lot of pelvic pain. Relaxin kind of surges between 8 to 12 weeks. So, moms come in and are super confused because they're already hurting at week 8 and they don't even have a belly. And, it's all because of those hormone shifts. As that uterus starts to grow, we get a lot of postural changes. All of our organs shift up, our belly gets, a little bit, hanging out front, which puts some extra stress on our spine. Our breasts grow heavier, so we do get a little bit more rounded shoulders, which we see a lot in our postpartum moms that are nursing. So we can actually help correct a lot of the postural alignment and give you some good ergonomics for ways you can sit at your desk or your chair so that you can minimize your discomfort. But chiropractic care is safe. Before, during, till the moment you're up in labor, it is safe. We'll talk about it a little bit later, but it's really, really important to make sure you are seeing a chiropractor that is certified in pregnancy, doesn't just treat random pregnant moms here and there. There's a big, big difference between treating somebody who does this every day, all day long, and somebody who just dabbles in a pregnant mama, here or there when they're doing their regular adjustments. So. Okay, creating your birth team. So depending on what type of experience you're looking for depends on your, birth team, your pregnancy, labor, and your postpartum recovery. So you want to be in alignment with people that have your same philosophy and, really give you a feeling of autonomy and safety. So whether you choose to do, more of a midwife versus a traditional, medical route, whether you have a birth doula or a postpartum doula. Obviously, as a chiropractor, I would love to be part of your birth team. We also do acupuncture. Massage therapy is wonderful. We have that in our office. Pelvic floor PT, if it was up to me, every woman would have pelvic floor PT as part of their postpartum recovery because we all need it. Even if you don't think you do, you need pelvic floor PT, and they're just very, very hard to find here in Central Illinois. And we need more of them. And it's just such a blessing that that women can have access to that, but we just don't have a lot of providers around here. But what an amazing addition to your birth team. So steps to build that birth team, we want to think about, what are you looking for? You need to discuss your birth experience. Make sure your partner kind of knows what you want. What kind of approach do you want to take? Do you want more of a natural holistic pregnancy? Do you want a traditional medical pregnancy? Educate yourself on the different options. If you're going to be in a hospital setting, what are you allowed to do at that hospital? Can you walk around? Can you sit on a ball? Can you get in a tub? Can you get in the shower? Or are you, basically strapped to the bed and can't move? If you want a more holistic birth, a birthing center, probably will give you everything you're looking for. Some women choose home births. They want that experience with their other siblings around, the other kiddos around, or they want, feel safe in their own home. So it's just kind of what experience are you looking for? And when you kind of decide that, then you can fill in your team with either more holistic or more traditional medical providers. Don't hesitate to talk to multiple people and, go to multiple doulas or just interview people and look for who supports your choices. We've had moms transition to, from a traditional medical facility to a birth center late in their pregnancy because they're just not feeling heard. And, we will help guide you in our office with, people that we feel like would support you in what you're looking for. But understand how each team member can help you during pregnancy, during labor, and afterwards during your postpartum recovery. I met with a doula a while ago, and I had no idea what a postpartum doula actually does. I had no idea how beneficial that would be, especially if you don't have family around, and how they help cook meals and they do laundry and they make sure you're eating well and, just taking care of yourself. And it's just a blessing if you don't have family in town to have somebody like a postpartum doula. If your spouse isn't loving the whole birth scene, having an actual labor doula, somebody to help you and advocate for you, is a great option. So you want to make sure you're comfortable with your team. Trust and comfort are huge when it comes to your birth experience. This is a very, very private experience. You know, our bodies are kind of exposed in positions we've really never been in front of other people before. And so you want to make sure you feel comfortable and you feel good about basically being naked in front of people, and that they support you in that. So ask questions, ask about their philosophy, ask all about their protocols. What's your C-section rate? When are you allowing me to go past my due date? When are do you do inductions? How soon do you do inductions? Will you let me go over my due date? Whatever you want to make sure they respect your choices. Unless there's harm for you or baby, then, medical necessity takes urgency. But, in lieu of mom and baby doing well, will you respect my wishes? So obviously informed consent, they need to tell you what you're getting into. You need to know that going into an induction puts you at a higher risk for C-section rate. You need to know that C-section rates, can then cause milk delay. It can cause issues with babies coming off the anesthesia. You have the right to refuse consent based on what you feel. There's a lot of information around now about, the certain things that they do to baby right after birth. Things like if you want delayed cord clamping, if you want golden hour with the baby, if you want a nurse right away. Those are things that need to be discussed with your birth team. We do have the book Well-Adjusted Babies in our office. So we have kind of a lending library. If people would like to read it, we'd be happy to get that to you. You can also find it on Amazon. So talk to your partner too, because your partner may not have any clue about any of this and may just assume, if they ask, oh, is she ready for her epidural? And hubby is like, yeah, let's do it. And mama was like, no, I didn't want an epidural. We're doing this as natural as I can. We just want to make sure we're on the same page with our spouses, because when you are in labor, everything gets a little muddy and things kind of you're not thinking clearly. And so we want to make sure we're all on the same page, and we have discussed this ahead of time. So yeah, those are also just additional questions to ask. So let's talk about nutrition, specifically iron and minerals. So we talked about trace minerals a little bit, which is kind of what we use in the LMNT packets. You can reach out to us and we'd be happy to send you samples, but the trace minerals are important for just health, cognition, physical performance, and hydration. Demands of pregnancy, we need to be ingesting more minerals than we do when we're not pregnant. So basically what happens is our modern farming practices have basically reduced all of the nutrient content in our soils. So it's hard to get minerals from our diet alone. So we need to either be taking trace minerals in the form of, kind of drops, or adding things like sea salt, cream of tartar, that kind of stuff to our water. Lemon and lime juice is a really great idea to add minerals to your water too. Iron can be tricky. A lot of women get anemic during pregnancy. Iron can also give you a lot of constipation. So, we want to make sure that, we have good iron supplementations and a good, master formula or a good prenatal, and that will give us great results. So selenium is really important for your thyroid. If you struggle with thyroid health, selenium is a mineral that you need to be taking every day. And the easiest way to get selenium is to have 2 or 3 Brazil nuts every day. That's really simple as I can say. Get some Brazil nuts, chop them up, put them over some Greek yogurt, you're good to go. Magnesium. Oh my gosh, half the population is deficient in magnesium. Our body uses magnesium for over 600 essential things that happen in our body every day. So there's there's different types of magnesium, and it can be used for day versus night. Some will cause you to poop, some won't. So talk to your provider about the right type of magnesium for what you're looking for. But everyone should be supplementing with magnesium. Zinc is great for gut health and DNA repair. It's also a great mineral for a lot of enzyme processes. I take zinc every day before I go to bed, just part of my routine. I want to touch on folate versus folic acid. So please pay attention to this part. So we want all of our supplements. If you have a prenatal, I want you to grab it and look if it contains folate versus folic acid. So what we're looking for is it's the natural form of vitamin B9. So folic acid is synthetic B9, and we do not want synthetic folic acid. We want folate. Even if it says it's a methylated folate, that's actually even better because of the number of people with the MTHFR gene. They can't really they have a trouble with methylation and detoxification. So folate is crucial for reducing neural tube defects. And without having, folate, then we can have issues with this unmetabolized folic acid in the bloodstream, and it can lead to things like cleft palate. We're tying some folic acid back to maybe some tongue and lip ties. People that are on the synthetic form, research still needs to be done, but it's kind of out there in the research that, maybe that has to do with some people being depleted in actual folate and overusing the synthetic form of folic acid. So check your prenatal and make sure it's got the actual natural form. Okay, moving on to second trimester. So we've got months 4 through 6, weeks 13 through 26. Your body's starting to adapt to all of the changes that are happening. You're starting to feel better. You're starting to feel like a human. You're starting to get a little belly bump. So you start to feel like, you actually are pregnant. Your rib cage and your spine start to adjust to the growing baby. And the spine natural curve does provide some necessary support, but it also can cause you some discomfort, like here in this lower back SI joint area. And so that's what we tend to see a lot in that second trimester. As that belly gets bigger, it puts more strain on the joints of our lower back. So yeah, you're visibly pregnant, but your center of gravity shifts, and your spinal curvature kind of grows to support that abdominal size. That initial hormone surge is kind of gone, so your emotions should be pretty stable. Sometimes we get a little pregnancy brain, we get a little forgetfulness, lack of concentration. So sometimes that's due to the hormones. Sometimes you're still not sleeping good, or your body's just going through a lot, or you're focusing more on, what's going on during your pregnancy, and, the housework and stuff kind of gets put to the backside. So, engage in things that help with your brain, puzzles, reading. I want you exercising during the second trimester, especially if you're feeling good. Get out and move your body. Walking is one of the most amazing things we can do during pregnancy. It's healthy on our joints, usually feels really good. So, we just want to keep in contact with our support network about how we're feeling, but that second trimester should be feeling darn good. Third trimester is you're at the tail end, weeks 7, 8, and 9, weeks 24 to 40 plus. Everything kind of continues. You will get a lot more relaxin surges, ligaments soften. So people can get a little bit more back pain in this third trimester, back pain, SI joint pain. Relaxin provides these protective benefits, but it does make joints pretty lax. So we got to be careful what we're doing. There's a lot of people that will CrossFit all the way through their pregnancy. Some people just don't have the stability for that, and they have to back off to doing just really lightweight stuff. But the biggest thing is we want you moving during your entire pregnancy. We want you to be in shape for that birth, and we want you walking, doing lightweight training, something that feels good to your body but doesn't overload it. So as you start to get bigger in that third trimester, you will not be sleeping as well. Some people are up to pee all the time. Some people have some pregnancy insomnia. So sleep can be a challenge in that third trimester. Women start to nest. They get this energy. They want to get their home prepared for baby. And it's just kind of part of that hormonal changes. And, mamas will know, they're like, I'm nesting, I'm getting all my stuff ready. But I think sometimes we feel so crappy for so long that when we actually feel good, it's like life-changing and we want to get all the things done. So, your relaxin is going to peak again close to birth to allow your body to get ready for labor. And then we have the, instability kind of rising in the joints again. And as baby kind of gets engaged into the pelvis, we're going to have a little bit more pelvic discomfort, maybe a little bit of lightning crotch from baby's head kind of bumping against that pubic bone. So that's when we really see the mamas is late in their pregnancy, when they really start getting some discomfort. So make sure you're using pregnancy pillows or even some maternity belts to help support you. Use the energy when you've got it. Get organized, just don't overdo it. Just take some breaks and, work on your pelvic floor and, get some exercises ahead of time for that. You can actually have pelvic floor therapy while you're pregnant or before you get pregnant to kind of prepare your body for labor. So if you've not watched our Dystocia webinar on preconception, that's an amazing one to talk about birth and how birth interventions can affect baby. Everyone's pregnancy is unique and your body changes differently than anyone else's. To say like you will have pain during your pregnancy may not be true, especially if you've had chiropractic care before you get pregnant. Most women do really, really great and don't have a lot of issues during their pregnancy. We're here to support you, whether we're just adjusting you for alignment issues, or trying to keep your sciatica under control or get rid of your lightning crotch. We're here to help you. So we here at Align Family Wellness, we understand all about prenatal care, and we understand how it's important for you to be adjusted before pregnancy, during pregnancy, and we help to support you postpartum after pregnancy to help heal your body. If you want a more personalized approach to your pregnancy journey, we're here for you. We're going to run some neurological scans on you, and you'll see a lot more about that in our preconception webinar. But it just gives us a good picture of what your body is doing, during that pregnancy, so that we can focus on anything we need to specifically. And we want to work together to make your pregnancy as comfortable and joyful as possible. I want to make sure that you are getting the right kind of care and the right kind of prenatal care. If you're searching for a chiropractor, if you are not local, we can send you a link to search for what we call a Webster certified chiropractor. Webster is a technique that allows baby to get in good position for birth. If you have a transverse baby or a breech baby, Webster is the technique we are using to help baby get in good position so that you can have a great vaginal birth. But we're local here to Central Illinois, but if you need a link to someone nearby, send us a DM or message us, and we will be happy to hook you up with a Webster certified or a specific prenatal chiropractor that will take good care of you during your pregnancy. Thank you for listening. Thank you for, spending your time with me and learning more about how you can have one of the healthiest pregnancies and how chiropractic care can play a role in that. I would love to take care of you if you are local, and you can see us local here in Central Illinois. I'd love to care for you. You can reach out to us, by phone. We have a new patient registration on our website, but we would love to chat more with you about having your best pregnancy. So thank you so much for listening today, and I look forward to seeing you soon.